So this talk on BII is going to be more or less part 2 of the surgical talk. We already talked about capsulectomy, en bloc capsulectomy. So now let's talk a little bit more about the surgical procedure and the recovery, the early initial recovery after surgery. So you can imagine that taking the entire capsule out is a pretty big procedure. It's a lot more complicated than your original procedure of putting the implants in. So we want to dissect the entire capsule out, but we're often typically working through a fairly small incision, maybe bigger than your original incision. Now, if you're having a lift, a mastopexy, that actually makes my job easier. I've got a bigger window to look through, and we'll talk about mastopexies and what other maneuvers might be done for aesthetic improvement after the capsulectomy in a later talk. But you know, if I have to take this capsule out in one piece with the implant through an incision that was made originally, I probably have to lengthen that incision, and hopefully that incision's in the inframammary area. If it's periareolar, I may or may not be able to do an en bloc through that, and in other words, may have to make an inframammary approach. I'm using a lighted retractor. There's a lot of retraction, in other words, like pulling from my assistant to kind of create a space that I can look in and work in. And there are certain spots during the procedure that are tricky, and if the implant's under the muscle, that's certainly more difficult than if it was placed on top of the muscle. Separating the muscle from the implant, and more importantly, separating the capsule from the underlying rib cage is very tricky and it's difficult, and it takes some meticulous dissection, and we have to slow down, and it can be done with the cautery, sharply, or what I've often done recently is elevate this very, very thin capsule off the underlying rib, what's called periosteum. It's the layer above the rib. That's where the capsule and the rib are super stuck together and very difficult to peel off. So sometimes what I'll do is inject some water, some saline, through a blunt needle underneath there to separate. And that works pretty well in certain circumstances. But you know what? These capsules are super thin. They're like wet tissue paper, and sometimes we'll poke holes in them. Okay, that just happens, and anybody that tells you it doesn't is full of it. So we do occasionally get some holes in there. Again, people sometimes worry about what's inside spilling out. Well, if you do have an infection or something like that, yeah, you wouldn't want that to happen. But again, those folks typically have thick capsules. The inflammation is greater. We might have to drain that first. The most common BII patient does not have any of that going on, so there's not fluid around the implant typically. So I don't think it's a big concern, but again, we're taking the whole entire capsule out. Now, when that capsule comes out as one piece, now we've got this raw situation down there. We've also got the edge of the pectoralis muscle, if it was done underneath the muscle, that we have to repair. So we repair the pec muscle down to the chest wall with stitches, and then we put in a drain, and I'm a big fan of drains. Early on when I was doing this, I would put drains in some people if they were from out of town, but many of the locals I maybe wouldn't, because I could see them in the office and drain any fluid with a needle if it swelled up with fluid, that the pocket that is after surgery. But it happens enough that I think drains are a really good thing, and pretty much everybody gets drains now. And drains are just a perforated tube that lays inside the pocket, drains the fluid and blood out into a little bulb, and that bulb is emptied 2 or 3 times a day. And the drain comes out within a week. So it's not a big hassle really, and it prevents other hassles. So that's kind of the procedure. You're in a compression bra afterwards. You typically see me the next day. The drain's out in a week, like I said. Pain is variable, but usually pretty controlled. I do offer a Exparel, which is a long-lasting pain medicine that some people opt to use. It's an extra expense, but that does help. But you're going to need some narcotic for a little while.